3. We are live.
Good afternoon, everyone. Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist, Oasis Fertility, Belagavi. Today, I am talking about lifestyle and infertility. So, human health, it mainly depends upon many factors, such as lifestyle of a person, his family history, the rest he is taking, then the health he is caring about, then environment, the diet he is consuming, hygiene of a person, then sleep patterns, then what exercise he is doing, then his stress level and relationships. So the important factors becomes like age of the patient, weight of the person, then his physical activity, stress level, tobacco chewing, diet and nutrition, alcohol consumption, caffeine, drugs, then STD infections. So these all how they causes infertility. I'll be talking one by one. Age becomes very important when we see the fertility level of a person because human reproduction it is greatly influenced by the age, and this is because so many physiological changes taking place both in men and women as they grow older. So although age affects both males and females, the most significant impact on reproduction is maternal age. So when we see when the fetus is at 20 weeks of gestation in uterus, there are about 6 millions of primordial follicles, which decreases by birth up to 1 to 2 millions. And by the puberty, it will reduce about 5 lakhs. So fertility age relationship in woman, it mainly depends on the number and quality of her eggs, and as she ages her eggs starts degenerating, and over the time low egg count and poor egg quality makes it difficult to conceive and have a healthy pregnancy. So when we look at AMH, that is anti-Mullerian hormone, which is a marker of ovarian rhythm, it starts declining. It shows a decline when we see by the age of 25 years, it will be 3 nanogram per ml. It will reduce to 1 nanogram by the age of 40 years. So even aneuploidy status, that is abnormal embryos forming, it increases as the patient's age increases. So the percentage by 10% at the age of around 25 to 30 years, it will increase up to 80%, 70 to 80% by the age of 40 years. Even the risk of miscarriages, the percentage, it will increase as the age increases from about 13% to 51% by the age of 40%. So delayed childbearing and effect, what is its effect on endometrium is because the endometrial milieu, it may become more inflammatory as the woman ages. And we can see more of pro-inflammatory proteins significantly higher in a woman in their around 40 years of age than those in their 20s. Even the adenomyosis, the percentage, that is we see 2 in 10 women by the end and up to 40 years of age, 40 to 50 years of age, we see the incidence will increase to 8 in 10 women. And even the percentage of fibroids, that is 5 to 10% infertile women, we can see fibroids. So when we look at paternal age, as the paternal age he increases to 35 years, the semen parameters began to show decline as the age advances. So after 35 years, reproductive potential of a man drops sharply as DNA in the nucleus fragmentation starts. So with aging, the degenerative changes occurs in the germinal epithelium. that leads to fall in the number and functions of the Leydig cells, thereby affecting the spermatogenesis through decrease in the testosterone level. So delay in starting a family and aging among men may lead to production of poor quality spermatozoa. And semen volume and motility decreases, even morphology becomes increasingly abnormal. So effect of aging on increased DNA fragmentation was reported to be a contributing factor to the low success rate of assisted reproductive technology treatment in infertile couples. So, in summary, advanced maternal age, the risk factors of miscarriages, genetic abnormality, then pregnancy complications are increased, and there is increased chance of cancellation of IVF cycles. And the couple may opt for self IVF, that is patient's own eggs, or if the patient's AMH is very low or the ovarian reserve is very less, then she might opt for donor egg IVF or donor embryo IVF cycles, or she might go for become a case for surrogacy. And advanced paternal age on infertility causes decrease in the sperm quality, that is volume of the semen, sperm count, progressive motility and morphology decreases, and it leads to adverse reproductive outcomes such as pregnancy loss, premature births, stillbirths, and the birth defect in the offsprings such as schizophrenia, bipolar disorder, autism, then childhood cancer, and other disorders like achondroplasia, Klinefelter syndrome, etc., they will increase as the paternal age increases. So next comes the BMI, that is body mass index. The normal BMI should be between 18.5 to 24.9, and whatever if the BMI is less than 18.5, they are called underweight, and if the BMI is more, that is if it is between 25 to 29.9, then it is overweight, and more than 30, it is the person falls under obesity. So, how this obesity causes infertility? The hyperinsulinemia, which is caused because of the increased fat cells. Increased fat cells secrete more of increased production of the estrogen, and the primary sex organs that occur in a state of high body fat is interpreted as birth control by the body, hence limiting the chance of conception. And the effectiveness of this lifestyle intervention was assessed among some infertile women with obesity. And the authors reported that lifestyle intervention increased the natural conception rate among anovulatory infertile women with obesity, but did not affect the rate of healthy live births. So, insulin resistance, that is hyperinsulinemia, it causes early follicular atresia, delayed meiotic maturation, increased aneuploidy, and increased follicular apoptosis. And this causes decrease in the serum hormone binding globulin in the liver and decrease in the gonadotrophins and growth hormones, altogether leading to infertility. Then, in cases of PCOS, there is a genetic predisposition to excess ovarian androgen secretion, that is decrease in the testosterone level, which causes hirsutism. Then increase in the level of LH secretion by the pituitary, leading to anovulatory cycles. So obesity, in case of either paternal or maternal obesity, it negatively affects the ART outcomes. And female obesity has been shown to be associated with poor pregnancy outcomes, including increased rate of congenital abnormalities. And the person may go for increased chances of cesarean deliveries, then preeclampsia, gestational diabetes, fetal macrosomia, stillbirth, and post-pregnancy are some of the risk factors of obesity. It has been reported that physical activity, if these obese patients, if they undergo physical activity, it improves cardiovascular risk factors, hormonal profile improvement, and reproduction function will be increased, and decrease in the abdominal fat, blood glucose and blood lipids, and insulin resistance are seen, and improvement in the menstrual cycle and ovulation and fertility improvement is also seen with good physical activity, and decrease in the testosterone levels and free androgen index and increase in sex hormone binding globulin are seen with the good physical activity of a obese person. So what are the effects of this elevated BMI? It is significantly associated with infertility and increased time to pregnancy. So every unit of increase in the BMI, about 29 kg per square meter, reduces the likelihood of natural pregnancy by 4%. So these poor outcomes are reflected in obese women undertaking ART cycles, with maternal obesity being associated with reduced implantation and clinical pregnancy compared with the lean woman, and reduction in the live birth rate of 15%. And male obesity, even increase in the adipocytes level, it causes increase in erectile dysfunction and increase in the scrotal temperature and increase sleep apnea, disrupts the nocturnal rise in the testosterone, leading to oligospermia, azoospermia, and increase in the DNA fragmentation index, and even increase in the estrogen hormone, insulin and leptin, and decrease in the testosterone altogether leads to oligospermia, azoospermia, and decrease in the semen volume. So how about undernutrition causes infertility? So ovarian activity is suppressed in women with eating disorders and exercise induced amenorrhea through pathways in the hindbrain. So the combined prevalence of this bulimia nervosa and anorexia nervosa is approximately 5% among women of reproductive age. These both disorders suppress the ovulation in severely affected women, and it accounts for 60% of women with anovulatory infertility. Bulimia nervosa, it is an eating disorder that is characterized by binge eating, which is followed by fasting or self-induced vomiting or purging. And it is an emotional disorder that makes one have a distorted body image and an obsessive desire to lose the weight. Whereas anorexia, on the other hand, is also an eating disorder that is more of psychological condition marked by extreme of self-starvation due to distorted body image. The likelihood of cure is higher with bulimia nervosa. So physical exercises, the most effective fertility exercises alternate between low to moderate level cardio workouts with muscle strengthening, and some of the best fertility boosting sports include light jogging, swimming, brisk walking, dancing, and Zumba. Fertility yoga, which combines exercise with meditation, is a popular alternative therapy for fertility. So, next comes the smoking, how it affects fertility is in females. This cigarette contains several harmful constituents like nicotine and cadmium, which is found in the follicular microenvironment in smokers. And this smoking causes thickening of the zona pellucida in smokers, which makes the sperm penetration very difficult. So smoking, it disrupts the ovarian function and depletes the ovarian reserve. And smoking causes even early menopause 1 to 4 years early. In males, this smoke contains nicotine, cadmium, lead, superoxide, and hydroxyl radicals. It adversely affects the reproductive health in males, and it is observed to reduce the sperm concentration, morphology, and motility, as well as increase in the DNA damage. Thus, this smoking causes decrease in the sperm count 19% lower than the non-smokers, and increases the abnormal morphology and DNA mutations. The decline in the semen quality was found to be more marked in heavy smokers who smokes more than 20 cigarettes per day, and moderate, that is 10 to 20%, 20 cigarettes per day smokers, compared to the mild smokers that who smokes 1 to 10 cigarettes per day. Let us see how alcohol is related to infertility, how it causes infertility. This chronic alcoholism consumption, it alters the micronutrients absorption in the small intestine. So alcohol, it depletes many essential nutrients from the body, such as vitamin B, zinc, iron, magnesium, calcium, sodium, potassium, etc. And these vitamins and minerals which are needed for most functions, including reproduction. So apart from damaging other organs of the body, such as liver, heart, and nervous system, it also affects reproductive health. The kind of damage, it mainly depends upon the type, amount, and duration of alcohol consumption. In females, it causes alteration, that is changes in the ovulation and menstrual cycle regularity. Although acute alcohol consumption may not harm the menstrual cycle, it also reported to negatively affect the fertility treatment outcomes. And chronic overconsumption of the alcohol may lead to decline in the ovarian reserve and fertility potentials in women. Markers of ovarian reserve and fertility potential, such as AMH and FSH and antral follicle count, they were reported to be lower among alcohol users when compared to non-alcohol users. So in males, chronic ingestion of high concentration of the alcohol, it affects sex hormones, testis, epididymis, and ultimately fertility potential, and thus suppresses the synthesis of hormones at the level of hypothalamus, the anterior pituitary, and gonads. This all leads to poor semen quality, obstruction of seminal tract, and tubal damage. The findings suggest that fertilization failure as alcohol intake can reduce the success rate of IVF treatment by decreasing the oocyte yield and live birth rates. Then caffeine, how it causes infertility. The caffeine contains many hundred active components, that is stimulants, and high intake of caffeine, that is more than 5 cups or 500 milligram per day, delays the pregnancy. It interrupts egg fertilization and implantation process. It also causes withdrawal symptoms such as headache, nausea, irritability, etc., and also increases the risk of miscarriages because it can cross the placental barrier. And high level of caffeine consumption has been associated with increased risk of stillbirth. So there is no definite amount or safe level of caffeine consumption, but about 200 milligram is considered moderate for those breastfeeding, pregnant, and trying to conceive in a woman. Then about illicit drugs, such as marijuana, cocaine, heroin, and methadone. Marijuana is capable of binding to the receptors in a reproductive organ, such as the uterus and ductus deferens, and significantly affects the sperm function and sperm morphology. Then cocaine, it impairs the ovarian responsiveness and alters the sperm function. Then heroin and methadone, also known to cause amenorrhea, and anabolic steroids can reduce testicular sperm production. Let us see how stress is related to infertility. Many forms of stress, such as physical stress, social or psychological stress in a modern lifestyle, it leads to reproductive treatment failure. The psychological induced stress can lead to impaired gonadotrophin release, low serotonin secretion, and elevated prolactin levels. Anxiety and depression, they could severely affect the spermatogenesis, mainly by depressing testosterone secretion. The hypothalamic pituitary adrenal axis has a direct inhibitory action on the hypothalamic pituitary gonadal axis and Leydig cells in the testis. So, this gonadotrophin inhibitory hormone also has an inhibitory effect on the HPG axis, which results in fall in the testosterone level, which causes changes in the Sertoli cells and blood testis barrier, leading to arrest of the spermatogenesis. Then corticotropin hormone inhibits GnRH secretion, and glucocorticoids inhibits pituitary luteinizing hormone and ovarian estrogen and progesterone secretion, thus leading to hypothalamic amenorrhea. Then occupational factors such as long working hours. The long-term work can cause sleep disturbances and stress, which in turn can create hormonal disturbances. Hypothalamic pituitary adrenal activation, which is related to sleep disorders, can also interfere with the reproductive system. Stress affects the hypothalamic pituitary adrenal axis, changes hormonal levels such as LH and luteinizing hormone releasing hormone, and glucocorticoids such as cortisol inhibits the gonadal axis. Then working in a high temperature profession, they cause seminiferous epithelium, which is sensitive to the elevated temperature. So in scrotum, temperature is maintained at 2 degrees Celsius below the body temperature. Each 1 degree Celsius increase in the testicular temperature leads to 14% decrease in the spermatogenesis. So men at work who is exposed to pesticides, heavy metals, heat are at increased risk of DNA damage in the sperms, early pregnancy loss, and genetic mutations. Even tight cloth binders causes degeneration of tubular walls and fertility sterility results. And even hot baths, they reduce the count of the sperms. Then mobile phones, radiation, although there is significant debate in the scientific literature on the impact of mobile phone irradiation on male infertility, it is recommended to keep the mobile away from the scrotum. Then in laptop users, both thermal and non-thermal mechanisms have been similarly involved. The state of the art on this topic is limited and it is still in progress. Prolonged sitting in the car is another risk factor for the rise in the testicular temperature that increases about 2 degrees Celsius after 2 hours of sitting, continuous sitting. The type of clothing a man chooses to wear may have effect on reproductive health. That is, tight fitting underwear and pants showed a relative risk of 2.5 of having impaired semen quality. Although also hot baths, jacuzzis, and saunas may also worsen the fertility parameters. So practical recommendations to modify the lifestyle behaviors are, so age plays a very important role in determining the fertility of both partners, male and female. The peak of fecundability is before the age of 35 for men and 30 for women. Infertile couples should access care early after a maximum of 1 year without conception and 6 months among the older couples. Couples trying to achieve the pregnancy should limit or quit smoking. The risk of miscarriage will be reduced and menopause will be delayed by 4 years. Also, passive smoking should be avoided. Then weight plays a very significant role in fertility. Therefore, maintaining a healthier weight will help to prevent the hormonal imbalance, which adversely affects fertility, thereby improving ovulation and the risk of miscarriage and other complications. So, abstain from alcohol consumption when trying to achieve a pregnancy. Caffeine also appear to have a negative effect and should also be consumed with caution. Infertile couples should avoid anxiety and emotional stress. Moderate regular exercises could help to release endorphins, which would help relaxation. Nutrition and exercise may impact fertility both in men and women, so good nutrition and balanced diet should be encouraged. Infertile women should consume foods low in saturated fat, red meat, and high in vegetables, legumes, and antioxidants. It is better to avoid all unnecessary medications and recreational drugs. Avoiding excessive irradiation by reducing contact with electronic gadgets like mobile phones that emit electromagnetic waves may prevent infertility. It is not possible to eliminate all hazards in the environment, but efforts can be made to reduce them. Thank you.